Good day, everyone. My name is Dr. Mohammad Al-Haddad. I am a gastroenterologist and Associate Professor of Medicine at Indiana University School of Medicine. On behalf of the co-authors of this paper and my co-first author, Dr. Michael Wallace, I would like to thank Endoscopy Journal for the opportunity to publish our work. The title of our paper is Fine Needle Aspiration of Pancreatic Cystic Lesions, a randomized study comparing standard and flexible needles with long-term follow-up. Our co-authors come from a variety of institutes around the globe, including Mayo Clinic in Jacksonville, Florida, Massachusetts General Hospital in Boston in the US, Asian Institute of Gastroenterology in Hyderabad, India, Shanghai Hospital in Shanghai, China, and Columbia Presbyterian Hospital in New York, USA, Beth Israel Deaconess Hospital in Boston, USA, and finally Mayo Clinic in Scottsdale, Arizona. The aim of our study was to assess the value of EOS-FNA in the diagnosis and the impact on management of pancreatic cystic lesions. EOS-FNA has been performed for many years for aspiration of pancreatic cysts, but our study aimed at evaluating the role of FNA on the outcomes, but also the ability to accrue sufficient fluid for cytology and molecular analysis. This is a prospective study that enrolled 250 patients that were randomized over the course of the study to aspiration using 3 different needles, all of them manufactured by Boston Scientific, and Boston Scientific is also the sponsor of this study. The needles were 19 flex, standard 19 gauge needles, and standard 22 gauge needles. Crossover was allowed in case of failure of FNA. We have concluded after enrolling and analyzing the data that although the percentage of cyst volume aspirated was no different between the 3 needles that we assessed, we found that 19 flex was significantly associated with a higher success rate of FNA, and success was defined as the ability to accrue fluid that was sufficient for molecular analysis if needed, or biomarkers including CEA and for cytology. We also evaluated the overall accuracy, diagnostic accuracy basically, of EOS-FNA, and we found that this was 84%, which is pretty significant compared to the gold standard of histopathology in patients who were followed up to 2 years with surgery. And we found that to be approximately 77% in those patients who did not undergo surgery but were followed clinically, and the diagnosis was made on clinical grounds as well as cytology and biochemical and tumor markers of the cyst fluid. We found that EOS-FNA was extremely safe with only about 1.2% complication rate, and this is consistent with previous literature. So overall, our study concluded that oral needles are successful and sufficient in terms of providing sufficient fluid from the cyst for cytology and tumor marker analysis. And we found that EOS-FNA is a very safe procedure. In fact, complication rate is around 1.2% for the serious adverse events. And the 19 flexible platform of needles, I think, is better suited to sample some of the cysts that can be more difficult to aspirate, like cysts in the head of the pancreas or the uncinate process, and should be considered in those situations. We thank Endoscopy again for publishing our work, and thank you for listening to this summary.